One of the most important contributing muscles to low back pain is the diaphragm. The diaphragm spans the entire underside of the rib cage from the front all the way around to the back. The diaphragm separates the abdominal cavity from the thoracic cavity. What happens is the diaphragm typically becomes underactive, which allows it to retract more into the thoracic cavity. This can typically happen when we perform stress breathing. This is just simply breathing that we perform under stressful situations. And what stress breathing looks like is when we breathe using the muscles of the upper body, including the chest and the neck. And it just lifts the rib cage straight up rather than having the rib cage expand up and out, as well as the abdominal cavity expanding out. The way that it contributes to low back pain is the diaphragm has these two little legs called crura that comes down onto the low back, and it actually meets with some of the fibers of that psoas muscle we talked about earlier, or that hip flexor. What will happen is as the diaphragm becomes more underactive and it pulls up, it'll actually pull up onto the psoas muscle and lock up those low back segments. The best way to alleviate an underactive diaphragm is by performing diaphragmatic breathing exercises. This can help reactivate the diaphragm and decrease low back pain tension.
For the first diaphragmatic breathing exercise, we're going to start with one hand on the belly and one hand on the chest. What you're going to do is you're going to take a nice deep breath in through the nose and a breath out through the mouth. And as you breathe in through the nose, you're going to let the belly expand underneath the hand. And then as you breathe out through the mouth, you're just letting the belly retract back to its normal resting position. What we don't want to see is we don't want to see no movement in the belly and all the movement in the chest. Because that's going to activate more of the chest and the neck musculature, which is what we're trying to avoid. We're trying to get more of that diaphragm activity. You can perform this exercise anywhere from 5 to 15 minutes a day. The next exercise is going to be a more advanced exercise. So for this one, what we're going to do is we're going to place our feet up on the wall. And for this one, what we're going to do is we're going to breathe in, let the belly fill, and then as we breathe out, I'm going to drag my feet down. So my feet aren't actually moving, but I'm actually putting pressure down into my heels, so that almost like I'm trying to drag them down towards the floor. And then when I'm done breathing out, I'm going to breathe in again, and I'm going to relax that pressure. Let the belly expand again, and then breathe out again, pushing down. And this exercise, again, we can perform anywhere for 5 to 15 minutes. This exercise here is going to be much more of a diaphragmatic engagement. So we're getting more activation out of the diaphragm. It's going to be a little bit more forceful. If you're still in the early phases of low back pain, stick to the first exercise, and as that one gets too easy, then start moving to this one.